Wonderful, wonderful. Good afternoon, everyone. My name is Dr. Monique Howard, and I am the Senior Director of Women's Health Initiatives in the Center for Global Women's Health, University of Pennsylvania School of Nursing. Welcome to this afternoon's discussion, the impact of gun violence on women. This talk is important because gun violence is a very important issue in Philadelphia and around the nation. Our communities are struggling with the number of lives that are lost every day. In the news, you see yet another horrific episode every morning, every afternoon, and every evening. What can we do as a community member, as institutions, organizations, to save the lives of our community members? Now, to date in Philadelphia, there are approximately 192 homicides, depending upon when to date is, according to the comptroller, in 2024. And that's a 40% decrease from 2023. That's homicides. There were several factors that may contribute to this decrease. We have a new mayor, we have a new police commissioner, we have new technology and implementation of safety measures. But are we really experiencing a decrease? Are women in our community still wailing over a covered body in the streets, a body that was their child? Is there more that we can do? These are the reasons why this topic is important. It's also important to our co-sponsors, EMIR Healing Center, Northwest Victims Services, Philadelphia Anti-Drug, Anti-Violence Network, Anti-Violence Partnerships of Philadelphia, the Ortner Center on Violence and Abuse, Penn's Women's Center, and Penn's Violence Prevention Center. It's important to us at the Center for Global Women's Health, as violence and victimization is one of our priorities that we spend a great deal of time working on. We've got a great panel tonight. We have some individuals who work boots on ground organizations like Natasha McGlynn, who will be our moderator from AVP. Chantay Love, co-founder of EMIR Healing Center. Melany Nelson, executive director from Northwest Victim Services, and Michael Harris from Penn. They will be leading our discussion today. I have nothing else to say because the panel is fabulous. So I'm going on mute. But I do want to say that please use the question and answer, the QA function, to ask questions, and the chat to make comments. We're leaving time at the end. This conversation is going to be about 45 minutes to an hour, and then we're going to open it up for comments from you to continue our conversation. So sit back and listen to some of the notable people who do violence prevention, survivor work in our city of Philadelphia, and I will be back shortly. Thank you. Natasha.
Thank you so much, Dr. Howard, and thank you everyone for joining us for this webinar, spending your afternoon with us. I am Natasha Daniela de Lima McGlynn. I am the Executive Director of Anti-Violence Partnership of Philadelphia, or AVP. We are a victim service agency. We've been around for over 40 years. I'm very excited to be joined by my colleagues. We're all working in the same space, and I think they also know too that I'm the nerd that will prepare some remarks. I feel like I'll share some of my thoughts, my prepared thoughts, to provide some context into how we'll be diving into our conversation for today. So without further ado, I'll share my remarks and then we'll go around. We'll format it that way. So we do know the impact of gun violence on women in Philadelphia is profound, right? Gun violence is affecting women's physical health, their emotional well-being, their socioeconomic stability. And while gun violence in our city predominantly impacts young men, we're seeing an increasing number of women who are becoming direct victims, as well as suffering deeply as co-victims. Since 2015, the number of women shot and killed in Philadelphia has actually increased by over 50%. 2019 and 2021 in particular were the most deadly years for women, with women comprising 11% of fatal shooting victims for these years. However, as of today's date, women currently comprise 11% of fatal shooting victims in Philadelphia. And with a little over 3 months, more months to the year, we can expect this number to increase, which would then make 2024 the deadliest year for women in Philadelphia. A significant portion of this violence comes from domestic violence incidents. National studies actually show that access to firearms in domestic situations increases the likelihood of homicide by 5 intimate partner violence. And in 2021, domestic homicide surged in the city, with a large number of victims being women, and firearms were often a factor in these tragic incidents. Philadelphia bear the emotional toll of gun violence as co-victims. So they're the mothers, the sisters, or partners of individuals who have been killed. The trauma of losing a loved one to gun violence has lasting mental health effects, with women in the most affected areas, such as North Philadelphia, West Philadelphia, Southwest Philadelphia. They're often suffering from PTSD, anxiety, and depression, which comes with the economic consequences of gun violence. These consequences are severe. So losing a partner or family member can lead to financial hardship, especially if the victim was violence, often face high healthcare costs and a loss of productivity, adding to the economic strain. This issue is particularly pressing for mothers in neighborhoods with high levels of violence, where they not only struggle with financial challenges, but also experience the continuous emotional stress of raising children in unsafe environments. And that constant fear of your child's safety can interfere with a woman's ability to maintain employment, pursue education, among many other consequences. It should be very noted that Black women in Philadelphia are being disproportionately affected by gun violence. So that's reflecting broader patterns of racial and socioeconomic inequality in the city. Black women are more likely to be shot or experience trauma as co-victims compared to women from other racial groups. And what we are seeing too, data-wise, approximately 70% of female fatal shooting victims in recent years to date. So efforts are being made to address these impacts through victim support services, trauma-informed care, and advocacy. So I'm really excited to be joined today by leaders, very courageous leaders and exceptional leaders in our organization, in our community. So what we'll do, I would like to pose the question. Let's begin by discussing the growing vulnerability of women to gun violence. So if you can introduce yourself, a little bit about your organization, and what you are seeing from the ground. Okay, so let's start with Melany Nelson. Thank you.
Okay. Thank you so much. So I'm Melany Nelson, the Executive Director for Northwest Victim Services. A little history about me is that my mother was the previous Executive Director for Northwest Victim Services. So I've been associated with the agency since the 80s. And Northwest Victim Services was the very first community-based agency created and dedicated to helping victims and witnesses of crime in the city of Philadelphia. So for me, so I was at Northwest for 8 years and then left for a minute, but went to the DA's office and was also working with homicides. And I've seen an increase over the years in females being shot. At one time in our society, and everybody can relate to this, women and children were off limits. Well, that has changed. So it just breaks my heart that maybe about, and Chantay, you can speak to this, maybe about a month or two ago, there were 3 females, and this was on the news, who were shot in a car on Broad Street. And then just recently, we had a 13-year-old who was shot and killed. So the females that we are seeing that are now being shot, and of course, there are African-American women who are affected by gun violence, because it's a lot of our young African-American males who are being killed in the city of Philadelphia. So now they're on both ends of it. And yes, it has been a dramatic increase on females being shot in the city of Philadelphia.
Chantay.
Well, hello everyone. I'm glad we're able to join and just have this dialogue. I'm Chantay Love. I'm the president and co-founder of EMIR Healing Center, which stands for Every Murder is Real. We are a community-based trauma center that work with not only families and individuals, but neighborhoods that are impacted by homicide and violent crimes. We offer a trauma-informed and an infused approach to healing that's culturally competent based on the community that you're in. And to dive into the question and to have a discussion, I think that for EMIR, we see the violence that's happening towards women, we look at the whole entire family. And so even though we're talking about individuals that life is being taken, for the one homicide, the women have always been impacted because they have been impacted by losing their children, losing their partnerships, losing relationships, and also dismantling the family. The 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 fact that the actual female is being shot is an addition to what we've been seeing, because women have been impacted by homicide and violent crimes from the beginning. And so how do you normally do that? It impacts us is that we lose family. The idea of losing family members in your family structure destroys the growth of your heritage. And so we're talking about the elimination of a race of people. And so when you have the woman that's losing someone, or then she's even take her life is taken, then you're actually dismantling and slowing down the growth of a race of people. And so their ability to not even to see the future is huge. To even create family and life is huge. The fact that you're seeing more women being shot and their life being taken is what we're seeing, is that this trend that there is no distinction between women and men, and that the need for life and the value of life is in question. And I think that we as people need to figure out how do we create life and make it important. But women have been impacted whether their life has been taken or not since the beginning. The numbers, I think we need to look at the whole thing of their impact and realizes that even though the life is being taken, they have been impacted by someone else from the beginning. And so the numbers isn't decreasing from the impact of it, because we're losing valuable futures. Thank you.
Thank you, Chantay. Michael, if you can introduce yourself and share any anecdotes on how you have seen gun violence uniquely impacting women in Philadelphia.
Well, first, let me just say that it's an honor and a privilege to be here, and especially to be the thorn that's sitting between two beautiful roses that are my co-partners in this whole endeavor. My name is Michael Harris. I am the School, Faith-Based, and Government Relations Coordinator for the Philadelphia Anti-Drug, Anti-Violence Network, better known as PAAN. PAAN has been around now for the past 35 and a half years. And prior to that, since 1972, we were better known as the Crisis Intervention Network. I have been on the forefront between both agencies, PAAN from its inception and Crisis since 1982. So I've been doing this work for the past 40 plus years. When we talk about female violence, I need to go back to something that Melany just said, and I wanted to thank her very much for her support. The 13-year-old that was just killed last week is the granddaughter of one of my coworkers, supervisor on my job. It impacted not only that community, but it impacted that family, but it impacted the family at PAAN as well. To see the life of a 13-year-old that was just taken before they had a chance to grow. I've always said, and I've coined the phrase, that we're losing too many of our most valuable resources. And that's something has to be done about that. I just want to thank my coworkers that are here today for the valiant efforts that they put forth on the forefront for trying to help make a difference. Our agency is known for being boots on the ground. We're out there in the hot spots. We're out there in communities. We're trying to engage and touch people exactly where they live and try to help make a difference in their lives. Are we the panacea? Are we the cure-all? No, we're not. But yet, we're there daily, every day, to try to help make a difference. Female violence is too much. And Chantay said it right. I mean, it's just not about somebody being shot and killed, but it's about the mothers that are losing their children. It's about those homes that are being destroyed. It's about the whole fabric of the family that is being broken down. And so we can go on and talk about this. I mean, but it's something that has impacted the lives of women for generations.
No, I'm curious. Can you walk us through the journey of your client? Right. So Melany, I'll start with you. As the executive director of a victim service agency, what does it look like when you receive a client? And what does that support, what would the support look like for a client who has been impacted by gun violence coming to your agency?
So at Northwest Victim Services, I don't ask my advocates to do anything that I wouldn't do. Titles don't mean anything to me. So I'm an advocate. So whenever we are made aware of a shooting victim, no matter who it is, and no matter whether that shooting victims knows someone in high places or does not, we treat everybody the same, and we give them the utmost respect and courtesy, compassion. We love on all of them the same. So we learn of the shooting, and we are serving them based on their needs and based on when they want to be served, because we have to empower them. We don't want to over burden them in any way. So I work very closely with Einstein Hospital, very closely with Temple Hospital. So we'll serve these victims, and there's oftentimes where we're serving them in real time. So we will let them know all of our free services, whether we're helping them with relocation assistance, and collaboration is huge. And I know everybody on the panel can speak to this. So collaboration is huge, whether there's relocation assistance that's needed, filing the claim through victims' compensation, whether it's therapy. So we have 2 dynamic therapists. I have a licensed psychologist and an art therapist, whether we're offering those services to them, whether we just need to go and do a home visit and sit and speak to them, because we don't always need to file a claim. So whatever their need is, we're meeting them where they are, and we're serving them. And everybody knows I'm not a one and done. So I will be in their life for as long as they will allow me to be, and then I let them know that. So, and we work very closely with all 4 of our police districts, the 5th, 14th, 35th, and 39th. And all the other agencies throughout Philadelphia, because sometimes it may take more than one agency to serve their need.
I have to share that I am, amongst my colleagues, I'm newer to the game. And Melany, just as you're speaking, I looked up to you guys as my examples. Your leadership is truly exemplary. And I think it sets the standard for how victim services and how these solutions should be addressed and taken. So Chantay, yeah, if you can walk us through, like, a client comes to EMIR, what does that journey look like?
Well, I will tell you that we're very fortunate to have I have a dynamic team, and so they come to us not only looking for support around their trauma, and it's we kind of ask the whole family to come, or whoever they are, who's their nucleus, and so we're looking at who is the support system they have, and we walk them not only on doing an assessment, but to see what their needs are. And our families kind of design what they want. There's not no one fit, and we craft it around based on their culture and what their beliefs are. I will say I'm very honored to have what we call trauma support coordinators, which is what they do is they walk a family through their own trauma, design something that they need, and the family selects the services that they want. And we do that, and we offer them not only counseling, but support groups, but also what we call healing circles, which is designed for just them and their nucleus. People don't have a time limit for them being with us. They're able to be with us as long as they need us. And the good part is that they are able to not only get individual counseling, but able to get support groups. Now we're very fortunate to have 18 counselors and therapists that's master level and PhD, and so that we don't have a waiting list. but also so that they can meet the needs of our families, because a lot of families come to us. So I think that what you kind of see coming at EMIR is we kind of think outside the box sometimes on our support groups and our activities. So us doing trauma through sports is easy. Us doing it through horticulture, us doing it through music and arts. It's designed that way. So we are trying to feed your mind and your body and your spirit. And how do we help move you in a way that's supportive of you, what your needs are, but that you say it's okay. So we walk alongside you. And sometimes it's longer, especially when it's a homicide. I tell people there is no time limit on healing, but you have to also give people time, because you got to remember and be patient. And I tell families, be patient with yourself, because this is a journey that no one really should have to do.
Thank you so much, Chantay.
Mhm.
And Michael, can you walk us through what a client's journey experience may look like when they come to PAAN?
Well, it's not so much as they come to us, is that we go to them. When we find out or hear of an act of any type of violence that goes on in the communities, especially among our young people and our families, we are boots on the ground, and we're there to try to help offer our assistance to the family. Case in point, I have to go back. Even though Roscoe is a staff person, but we were there to lend our moral support to the family, to console them, to wrap our loving arms around them, and then reach out immediately to our partners to provide the additional supports and additional needs that the family might have. Um, Chantay said it well, and Melany said it as well as also, is the fact that there is no time limit on working with families. There is no time limit on trying to help them. I mean, because it's grief is something that is going to be with them for a period of time. You cannot put a time limit on it. The one thing is that you also have to remember that you have the situation that led up to it. You got the situation that is currently in place at the moment, because there's probably, if it's a homicide, then there's a person that might have been arrested. There's probably going to be a court case. The family has to endure that and go through that. And then prior to that, you also have the homegoing service for that young person. And the family still has to go through that particular thing. But then after all that, after the lights have dimmed, the family is still there, and the family still needs that support. And when most of the crowd has disappeared, we're still there making home visits, uh, making recommendations, making support offerings to them. If it's a victim that was not killed, uh, we have our human services department that comes out, and they will supply bandages and other necessary things for the family. If it's a father or a mother that has a little one, we will come out, take a needs assessment, and we've been known to buy diapers. We've been known to buy food. We've been known to buy even clothing for some young people that have to go to school. And so it's just not it's not just not a one-stop thing that you can do. And working with young people and working with families in general, you have to have a heart to be able to want to serve people and let them know that you care and that you're there for them.
Thank you so much all for sharing your respective processes. I think I'm curious, do you ever experience pushback from an individual or a community? Yeah.
I'll start with that. And I did. There was Nico, and Nico was 15, and Nico was shot multiple times. And his mother was very skeptical about me in the beginning. She wanted to know why I would help and how these services were free. She was very, very skeptical. But I was very laid back, and I would let her reach out to me. So after about a month or so, she said, okay, I'm ready for the services. I was able to file her claim. I was able to offer her therapy, but we still talk to this day. And she was very appreciative. And then all the media was in front of her house, and I'm yelling at them to get from in front of her house, but she didn't let me in, which was fine. I left that day, but she was very skeptical of me. And sometimes we have to be very mindful of that. And Chantay touched on that. And Chantay does all of Philly. So you have to understand, and it's important for us to understand when you're serving victims, each section of the city is different. So you can't treat one group of community members the same way you treat another group of community members, and you have to be genuine in everything that you do. So, but yeah, we get pushback sometime, and then you have to, and I think as a good advocate, you have to know when to step back and let them come to you, but also let them know I'm here for you whenever you need me.
Thank you. Chantay, do you experience any type of setbacks or?
Well, I just to piggyback off of what Melany is saying, I think that also what we have is you have people who are in their most vulnerable state. Their safety have been ripped apart, and they have not trusted a system that has let them down. So you have most people that are victimized of Black and brown communities who have been victimized of a system of a racist system that has not supported them, or who have wiped their community away as if it wasn't important. And so now that they are this horrific crime has happened, to expect them to trust right away is crazy. That's why we know that as providers, we know it takes time. And it takes time and patience because you're asking them to trust when they have been failed in so many different ways. Because you have to remember, especially if it's a homicide, it's to EMIR, murder is a clear example of a society and community that has been failed. And so to think that they will trust us right away is ridiculous. And so it takes time for us to build the relationship for them to allow us to allow us in. And so you see that right from the door from a lot of people. But what we have been seeing is that because we're in the community and a lot of us have been around, they start to trust us because we've been here. We also I could tell you, we get pushback not only for individuals, but you might get pushback from different communities who are not used to people who see us as part of police. And so they think we are part of the police, but we're not. And so you see, okay, they don't want no parts until they realize, okay, they're really offering human services, and that they see that no, they're not connect. They may work with them, but they're not going to be the ones to say, "Hey, well, I'm bringing the police in to lock everyone up," and I'm bringing. They don't until they kind of get that. Then there's a fear. I do believe that we are breaking down those barriers and those stereotypes because we are in the community, and as leaders on the ground, we get to change the narrative, but also being their voice. Because sometimes even the survivors who don't have the words to say, or especially if they're males who don't want to feel vulnerable but still feel strong. It's us who are saying this doesn't change your ability to heal, and the harm that happened to you don't change that you are still a man. And so you see all those dynamics happening. And so you see community groups like ourselves working with those. And so you see that pushback, not based on, not only just because it's a community that's been having violence, it's because they've been used to a system that let them down. And so when you have that situation, yeah, you're going to push back. I expect it. But I do know that we work very hard to allow them to say, okay, they can identify that you are who you are and that you're going to provide what you say. And so we come through, and that's what we all do.
I appreciate that, Chantay, because you just said, we provide how we need to. And Michael, in particular, you made a comment that PAN is able to provide supplies to your clients, such as, for example, diapers. And one of the challenges that I have observed and experienced with our organization is that the funding restricts us oftentimes from doing things the way we want to do. And for example, I'll give an example. We had a client, someone shot through their door, window was blown, door was blown, and to replace the door, to replace the window, that is not considered eligible compensation. It's not considered eligible for reimbursement under the Victims Compensation Assistance Program, right? But we know that that's required, that's needed in order for us to restore safety and immediate safety to our clients. Can you share, like, how do you guys navigate that type of these funding restrictions? Because that is being able to, as I'm hearing what you're all saying, right? Being able to meet our clients where they're at, what they need, that's going to go beyond oftentimes, I think, what we can do organizationally.
Well, let me be clear. We cannot do everything for a client, but yet we try to provide those basic needs for them. But when there's a case like there's been damage to a property, then we'll try to reach out to people that we know have done that type of work in the community, and try to pull on their heartstrings, tug on their heartstrings to see if they will come and try to help do something to provide and make it necessary for a family to be able to live and to stay in the property and feel safe. And so that's part of it. But I got to go back to something that both Melany and Chantay both said, and we have to touch on that word trust, because it always has been a trust factor. And Chantay couldn't have said it any better, that for years, people, when they see us come into communities, they feel that we're part of the police, or that we're working with the police. And we have to establish a rapport and a relationship with people to break down that misnomer that we're here to try to help and service you and try to help make a difference. You'll be surprised that people will push back on you. But once they find out that the key to not getting pushed back on is being consistent. And being consistent means that you just don't show up when there's a problem, but you have to show up before the problem happened, show up during the part of the problem, and be there after the problem has already taken place, to let people know that, hey, we're here in this community, we're here to service you. When we first started years ago, one of the things that we said is that we hire people that are indigenous to the communities that they live in. And so a lot of our workers are those that are indigenous to those particular communities. They know the people in those communities, and the people know them. And so that gives us part of a way to get into those communities. But the other part is the fact that, people have to gain your trust. They have to feel comfortable with you, and the only way that you can do that is by continuing to show yourself faithful, continuing to show yourself consistent, and continuing to be there when there's a need. Just don't show up just to be a wreck chaser. Just don't show up just to get the time on TV and be a glory person. I mean, but is there, when the lights are not shining, when the TV camera is not running, you got to be out there, and you got to be, working with people, serving with people. I mean, case in point, my partner, Melany's good friend, Charles Walker. Me and Charles, from time to time, will go up to Caring for Friends and pick up food packages and deliver it to seniors in those and needed communities. That is just a form of trying to support and trying to help those communities. And so when community people see you doing this and see that you're putting forth an effort to try to help make a difference in those communities, then they feel more comfortable that when there is a problem, then they're more comfortable to share information with you. They're more comfortable to open up their doors to you. They're more comfortable to allow you to come in to try to help get the additional support and resources that they need. And so that's the difference, man.
And Tasha, I want to touch on what you said as far as Natasha, as far as our grant money being restrictive. It's so important to make sure that we think outside the box as advocates. We just can't collaborate with other victim-based agencies. We got to reach out to the churches. We got to reach out to ministries, and we have to reach out to our elected officials because they have resources that will be able to help the families, like with the door and with the window. So I have ministries and other agencies that I can reach out to that are not community, that are not dealing with victims, but they help the community members as a whole. So it's so important that we tap into everyone within our community because that's how we meet the needs of those affected by crime.
How, building on that then, how do you see the city? Is the city assisting in your efforts? Do you feel like the city is doing enough to equally or in partnership address these issues? Yeah. How do you feel? Is this what's the city's role in this, and or like what's your experience? Is the city supporting your efforts, or are they filling any gaps that you might be experiencing?
When you well, I'll speak on the Office of Victim Advocate in the city of Philadelphia. I think they're doing an amazing job. I'm so happy that they assist with like the relocation piece alone. That has been crucial, and it has helped me with people that I needed to move immediately. So in my mind, if somebody's in trouble, I need immediate response. And the Office of Victim Advocate has been amazing with that. I just am recently helping, and this is so sad, that 16-year-old who was just murdered and found on King's property. Somebody actually posted on social media that they live on a 2100 block of Homer Street. This was posted hours after this young man got murdered. So now their family is in danger. But I was able to reach out to, and if we're speaking about the city, the Philadelphia District Attorney's Office, I was able to reach out to them and no one was apprehended, but the director, Donna Woods, doing an amazing job, they're able to help this family. So for me, the city is helping.
Chantay, do you have any thoughts?
Well, I will tell you that we all are very unique at trying to fill the gaps of things and services that are needed. And in order to do that, you have to partner with other people. Because I will be the first one to tell you is that we don't do everything and we don't want to. But when community comes together and you have the community do it together, then it changes how the navigation of it, and it changes the environment. It also starts the healing process for a neighborhood when the community does it together. I will tell you that the city have helped me out because they saw that the increase in violence and need for services came about, and so they had to step in. What I will say is that the state should step in a little bit more under victim services. I'm gonna be for real that victim services was always it can't be second. It can't, if we need to have the level of funding based on the level of crime if that happens. So for example, this is just me. So y'all can say Chantay said it. If we're spending a certain amount of money to incarcerate people, we should be spending the same amount of money for victims that's left behind. If we are doing all of those things, if we are trying to prevent violence from happening, we can't forget those that are here that still needs that support. And so I will tell you that the city stepped up stepped up for us and a lot of community partners in a huge way, because we have to drive this to a level of zero. But there also has to be funding for agencies to be able to utilize, to be able to do some of those things that you can't get someone to do. For example, I'm glad that my brother, can pay for some Pampers. But what would happen if that week 50 of them family needed Pampers? He should be, there needs to be a level of funding that is not so restricted, that meets the needs of the people that we're serving. There needs to be that opening that should happen. And we should be also increasing, especially around victims. When I'm looking at Philadelphia, I'm looking at healing 1.6 million people impacted by homicide and violent crimes. Then guess what? We need funding to heal 1.6 million people. And we need it at that level so that we could stop this from happening. Because although we can slowing down violence, you still have impoverished communities. You still have people that are still hurting from previous pains. You still have those things. And so we can't say, are we getting help? Absolutely. Do we need more? Absolutely. Should we all be in this together to do more? Absolutely. There shouldn't be a competition between us doing this or that. We should be saying as a whole community, we're doing this together and we're funding this so that we can drive something down, because the numbers are driving down because community partners are linked up in such a way that you haven't seen before. And they're using their own capacity to support one another's capacity. Well, can you imagine if we was funded differently and if we had some additional resources, what we could really do? And I think we should be asking that question. I think we should be requiring that, especially for survivors of violence.
Thank you so much. Like, do you see any challenges for PAAN in doing this work? We've now been talking about, restrictive funding.
There's always challenges. There's always a need. Can our agency always use additional funding? Most definitely. I thank the city for what they have been doing. But yes, the state can do a little bit more. There are some state elected officials that have done or are continuing to do their fair share, but it should be across the board. It needs to be for everybody. And let me just say this too. Our executive director, George Mosey, always likes to hang his hat on the last word in our agency, network, because network means that means just that we have to network with other people. We have to network with other groups. We have to network with other entities out there to try to make sure that things are taken care of. Violence is a health issue. And if people don't see it as a health issue, then we have a major problem. We're losing too many of our most valuable resources across this city. And the increase of female violence is just continuing to tug on your heartstrings. I mean, when you see females that used to be, like Chantay said, off limits, mothers and daughters were off limits, but now they're just being targeted just like anybody else. And so we need to come together even more closely and try to help do something more so to eradicate this. And so additional funding will always help. Additional funding never hurts. It's just the fact that when you get the funding, you have to do the appropriate things with that funding when you get it. And so, and that is by meeting the needs and meeting the challenges of our people in the communities.
I'm mindful of who may be watching in the audience. And so I'm curious, and this is just open-ended for anyone to answer, right? What can private entities? Like, what role can they play? What can they be doing? How can they be part of the solution?
Can I go next? Because what I am seeing is that when we're talking about private, when I say we all need to be all hands on deck and this needs to be a collective work, it's not just city and state and community partners, corporations, private funders, philanthropy, hospitals. This should be on their radar as a priority. But it should be a priority to fund nonprofits that are doing the work first. Now, I'm saying that because what I've seen is that I've seen partnerships happen. I have a collective of several community partners who partner with other entities, but they're receiving the low end of it. And so can you imagine if a hospital partners and partners like some of they do with us, is that if they're funding or they receive funding that is poured into their community or community partnerships, that absolutely should be happening. They should be supporting community partners that's doing this type of work. They should be hand in hand and neck and neck. It shouldn't be a thing that we know hospitals need to get involved and do some things, but the first priority should be what is happening in their community and how do they partner with community partners so that their lens is widened. Because in hospitals, people come and people go. People live inside a community. And so that focus should be that. And they should be doing it together with community partners, hand in hand. That's my 2 cents.
But on top of that, let me just say that when we talk about partners, I'm thinking about our universities that are here in the city, and they're in basically communities where people are living, where people are hurting. I understand about the college students, but also there are other families that live in and around those particular areas where the universities can at least look into try to see how they can partners with those particular communities, partners with those community groups and organizations that are doing something positive in those particular communities to help make a difference, to try to help stop some of this nonsense that's going on.
Well, Mike, some do it okay. Some do an okay job at partnering, but some of them don't. And how do we get them to change their thought pattern? And I'm saying, like, for the universities who 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 can partner and make a big difference, but feel like that they should lead it. And we know that they're making too many mistakes, especially on culture and competency and being able to connect. Like I've seen universities that connect across different places, that connect well with community organizations, that they don't do it unless the community is driving it. And how do we get that where they allow the community to drive it and they support that, or they add the best that they have? Because they've been around a long time and their entity is large, so they don't have the answers. Not without us.
Not without us. That's true.
I actually see a question in the chat that feels relevant. What can healthcare providers do to screen for guns and gun violence in the most culturally sensitive ways for our patients? Thank you, Bridget.
One is that when patients come in, they need to ask the critical questions. They need to, you have social workers in emergency rooms and ask the critical questions. Also, talk to the family. Let the family know that there are resources out there. Let the family know about EMIR. Let the family know about Northwest Victims. Let the family know about PAAN. Let the family know that there is additional resources out there for them to get involved in. One of the things that we also have to understand is that people are a victim today, but they can become the perpetrator again tomorrow. And so we have to stop this vicious cycle from going around and around and around and around. And we have to let them know that between your anger and your response is your right to choose. I mean, you have the right to make a positive choice. And we've seen it so many times that when there is a victim of gun violence or a victim of violence that is rushed to the emergency rooms, then we notice the crowds that are hanging around, and a lot of those crowds aren't there just for support. They're there also to talk about doing some additional retaliation and retaliatory problems. And we need to, have hospitals work together with community groups to help share some of that information so that we can try to stop this stuff before somebody else gets hurt.
Melany, do you want to share any more insight on challenges or?
Now, ask me the question again. I'm sorry, that health question again.
It's okay. I feel like I want to get your final thoughts on challenges, because I'm going to ask about challenges that you're seeing. We're identifying how, for example, private partners could be part of the solution, right? Or maybe about solutions.
I think Chantay summed that up, like when she answered that question. I echo exactly what Chantay said about that. As far as the private funders, we need money. We need a lot of it, and we need unrestricted funds. That's what we need. So when those 50 families come and need Pampers because their family was affected by gun violence, that's what we need. When we get those, again, I go back to the safety issue. I can't put somebody up in a hotel immediately if they call me and tell me their life is in danger. So again, we go back on that collaboration piece. Concilio, I reach out to them. They're so helpful. The Office of Victim Advocate, I reach out to them. They're so helpful. But if somebody calls me, I don't want to have to tell them, wait, let me see if you meet the needs and requirements within this funding application to see if I can, if this other agency is able to put you up. So there are many challenges. And then we're not even going to, so again, we're talking about gun violence. Let's talk about gun violence and carjacking. What about those people who are held up at gunpoint, females, males, and all of their information is taken? Again, I can't put them up, or I can't help them at that time. You know what I mean? So there are so many challenges, and hopefully we'll be able to produce some solutions soon.
I will share one thing I feel that is lacking. So much of the information that's out there about victims, it's not an accurate picture, as we all know, because victimizations are largely underreported. I think now back to your comments about building trust. I also think that we need to figure out improved practices, right, on how we can better capture that. Women don't go to the police. They will, but let's be real. Like oftentimes women, female victims will not go to the police. Is that a requirement that that the only way to report the incident would have to be the police? Can we think outside the box? Yeah. I see, Chantay.
Well, I will tell you that this is where I think that you have a few things happening. It gets a little tricky. Is that for hospitals? I'm gonna answer that other question about gun violence that someone asked in the question. Is that you have to be able to be culturally competent and sensitive to know the questions that you're asking around the trauma. And so we did a partnership with the hospital to help them craft questions that will get to the answers. And I think that what physicians fail to ask and see, they're really judging based on what they've been taught instead of going in deeper into the person. And so if you have somebody that's, and I'll give you one little tip that we do. If you have somebody that has if you are not asking your patients or your families, have you experienced violence or homicides, then you're missing the whole boat. because the trauma that they are experiencing, along with if they live in an impoverished community, it affects their health immediately. It does. And so how do you treat that? And if you're not asking those pertinent questions so that you can treat their health better, you're missing the boat. It's not even around about do they have a gun? Do they have access to a gun? If you're just looking at their health and knowing that they are changing and something's different is happening, you know something happening in their life. You can't, I can tell you sometimes what we do is that we'll have someone that comes in and we'll ask them to bring pictures because we want to see what they look like before. And if they hadn't gotten any help for the first year and you see this person has lost a lot of weight or have gained a lot of weight, something has happened in their life and no one's asking the questions. And so you ask the pertinent questions so that you can care for their health and you will have the relationship to go into something deeper. And they're not asking the questions. And I don't know if it's because health insurance is saying you got to see one person every 10 minutes, so they checking off the box and asking the simple things. But when do healthcare get into this and really treat the symptoms and what's happening? You can't talk about nutrition and someone's health and there's a food injustice here. It goes hand in hand. You're in the middle of the most violent community and you don't have resources or connections that you can have at your fingertips. That's problematic. And we should require hospitals to do better. They got to do better. We can't ask for anything less. And that also means sometimes they got to come to groups like Penn and groups like Northwest and groups like EMIR to get trained. Because if you're in the hospital all the time and you're looking out of this lens, but the world around you is changing rapidly, like that, then how do you level up like we do? You'll see community groups. We connect, we move, we create systems, and we create processes to meet the needs because the community is forever changing. Are you able to do that? And I think that they fail us when they're not, and they fail their own system when they can't improve the health care of someone when they miss so much large of the problem. I think that was the one question. I answered two questions. Did I miss anything, Melany? Did I miss anything, Mike?
No, you didn't, but
Natasha?
I do want to piggyback on this, and I know we got to wrap up. And with Chantay saying that with the healthcare, there I see and I hear all the time shooting victims that are released from hospitals, they have no health insurance
Health insurance.
and they can't go back to get their pain medicine. And then the hospitals won't give them because they're going back to the hospital for their hospital pharmacy to get their pain meds, and they can't. So that's a big issue for a lot of victims who are affected by gun violence, females who go back to the hospital to get their prescription and they can't. They can't even pay $20. So now they're in pain and they're suffering.
I have a
And
question.
then Melanie, then they start to self-medicate.
Oh yeah. Oh, most
And so
definitely.
now we have another problem.
Yeah, another
So
problem.
now they're self-medicating.
Yeah.
Okay. And then
Yeah.
we just compounded when we could do something to fix some stuff.
And again, I say that if hospitals, especially again, because we did it before, and it can still be done again. You have social workers in there. You have, let's take the three groups that are here today. If hospitals will reach out when victims come in and share information with us, okay, then allow us to partner with you to help make a difference in the lives of those people. Because it's just not that victim. It's also the victim's family. It's the victim's siblings and stuff that are also a part of what's going on in their healthcare. And so, hospitals have to learn how to utilize community. And you just can't, just take the patient in. shoot them out tomorrow. I mean, just like was just said just a second ago, you know, if they're not getting the medication from them, then they're going to get the medication out on the streets. Okay, and then now you're going to see that person again, but in another capacity, another situation.
You guys have been sharing, I think, a lot of different types of suggestions for audience members, but I want, you know, as we wrap up this discussion, what can audience members do to be a part of the solution? And Melany, we'll start with.
So I know I was looking down the list. So I will say this. So I see my sister Angela Wade on, she's on here, and I thank her for being on here. Unfortunately, her son was murdered. Beautiful, beautiful being. And he was either doing Uber or Lyft, and someone gunned him down. So I have been associated with this young lady for years, and she did not just sit back and let that horrible thing happen to her son. She has started a nonprofit in her son's name, so she's keeping his legacy alive. So she's fighting through her pain and not being able to sleep at night sometimes. So she is making a difference in the city of Philadelphia. So she's a loving on other mothers who have been affected by gun violence. So that's something any and everybody can do. Peer support is like none other. You know what I mean? You have those therapists, they may not have lost a loved one to gun violence, but peer support is priceless. So mothers like that, and I commend you, my sister. I see the CARES responders on the line who are doing amazing work. Shakina, who at CARES, the Jackie. So there's so many people I see on here. So you don't always have to be a professional to be an advocate. You can advocate for any and everybody and love on everybody at all times. I think, and listen, the power of one starts with you. So love on one another and help one another. And sometimes it doesn't mean that you have to talk. You could just sit in a room with somebody and hug them and listen to them and give them that shoulder. But I think no matter who you are, no matter what you do, you can always help those affected by gun violence in some way.
Chantay, what do you think audience members can do?
Well, I think that they can get connected to groups like ourselves. I think that also they could push elected officials to say, hey, violence needs to be the priority. Equity needs to be the priority. I think they can talk to their hospitals and say, hey, what are you doing to be a part of the solution? And I think that they can raise their voice. As Melanie said, being an advocate and doing advocacy is huge, because you'll see a lot of us that do direct services. We're so busy doing work, sometimes we don't have the chance to fight as long as we would like to fight. And I think that they should do that and be a part of a group. Join one, volunteer, offer your services, be a part, because guess what? We really can use your help. But there's a question in the chat about research. Did you see that? Could I tap on that? And I will tell you, and this is for researchers, you'll see that our community partners, we love working with data and research, provided it supports communities. Because what we won't be is a petri dish any longer. What we will do is that we will looking for research that impacts the community, that can drive right in the community and support the community, not just to be looking at data to come up with your own. We are past that. And as community leaders, we will not allow that. But what we really need is not only for you to look at violence, but also to allow us to be a partner with you so that we can get necessary data that we need and the research we need. but also how do we pour it into the community? It has to touch us. It has to impact us. And that's what I'm thinking that, I'm hoping that answers your question. Because I'm a data girl. I'm weird like that.
And thank you, Chantay. I want to add to that, from a research perspective, if you were using or partnering with a community-based organizations, a violence prevention organization, a community, go back with the answers and the results that you found. Go back with the realistic recommendations that your data analysis helped you come to, so that you were then sharing that information and not holding those answers to you for your next publication, for your tenure packet, so that you can get advancement, but the information that you got from the community, it doesn't go back. So close that loop, that loop that you started as a researcher, and make sure you share the information. Thank you.
I just wanted to say this one last thing from our part. My partners couldn't have said it any better. You want to get involved? Just contact any of us and volunteer your time and services. You want to get involved? Violence is a learned behavior. How is it learned? It starts at home. So those of you that are that are in your homes, talk to your family members about violence in your homes, because it's a learned behavior. They learned it. I learned it when I was growing up. It was the old adage. When I first went to kindergarten, my mother said that if Frankie hit you, what are you supposed to do? Hit him back. And so from that part on, when somebody hits you, you think about hitting them back. And so violence is a learned behavior. And so we have to train up people and to get them to understand something different. So volunteer your time. We're always looking for volunteers. We're always looking for additional help, that wants to volunteer at an event, or to go into communities and just to talk to neighbors and to do things of that particular nature. And then let me also say, we was talking about the diapers, but I had to just say that I had two mentors: James Mills, the founder of the agency on one side, Darryl Coates, and they were both my best friends, and I miss them. I'm here in the middle. I'm the last man standing. But Darryl said something that we put on the wall, and we used different phrases that both of them said. And Darryl said that when it comes to community, we will never cheat a child or the family out of the additional resources or the things that they actually need. So if a family needs some Pampers, if I got to go in my pocket and spend $20 to buy them some Pampers, then I will buy those Pampers for that particular family, because you don't know what difference that's going to make in that particular family's life, down the line. And so, agencies, we don't have all the funding, but yet we're going to find a way to make a way to try to help make a difference in the life of people.
Want to thank everyone so much for your time, your everything that you are doing to drive meaningful impact in our communities that have been impacted by violence, especially women. Again, as we see this increase victimization amongst women in our city. Dr. Howard, I want to thank you so much for connecting with us. And as I said earlier, Melany, Chantay, and Michael, they are the example of how it should be done and how we should work. So again, I want to thank you so much for setting the example, leading the way.
Sure. And thank you, Natasha, for moderating that. So add yourself to the list of names that you mentioned. I told you that we were going to have a really good panel and a really good conversation about gun violence and women and what happens in our community. We have a long way to go. We've made some strides, and we still have some ways to go. And some of the things I heard is about the importance of true partnership and what that really means. In partnership, where the outcome is improved health and well-being of the patient and the family. Partnership with university, healthcare systems, other agencies, elected officials, faith communities is very important. To be creative in ways in how you look for help. In our chat, we have placed contact information of the agencies that are here today. I want to thank Natasha, Chantay, Melany, and Michael for their commitment and their hard work, for all the work that they do for the families during their time of need. Thank you for who you are and for what you do, and for the strength it must take you to wake up in the morning and do it all again on the next day. I hope you continue to join us, to my audience, and join the Center for Global Women's Health and other events that are occurring later on this year. This webinar was recorded, so it'll be on our website, and I'll put our website in the chat. But again, we're the Center for Global Women's Health at the School of Nursing at University of Penn. Thank you so much, everyone, for listening to our conversation today. I hope to continue to provide opportunities for realistic conversation and discourse. Thank you to my panelists and my moderator for a job well done, and for answering my call. So I appreciate that. And so thank you to everyone else. Have a great evening, and I will see everyone in the by. Thank you.
A good one.